Imagine this. You lay in bed and the room is cloaked in complete darkness. Even with the absence of light, you find absolutely no comfort. This should be a place of refuge, but no, you find nothing but pain. Everything hurts, but the part that takes the cake is your head. It's throbbing, and you wonder if your brain might actually explode this time. You've tried everything: heat, ice, essential oils, pillows propped in different ways, a scarf over your eyes, neck positions from horror movies, taking a shower where you ended up on the floor of the tub, head in your hands. And don't forget the variety of meds. In the dark room, you continue to wait for this attack to end. It's not just your head that's the problem, though. You're afraid to move because if you do, you might send yourself running blindly to the bathroom, or cause the pain to turn up to a 20 out of 10. And don't forget the sensitivity. Literally, everything hurts. Sounds, light, touch, your muscles, even your hair. And even with your eyes closed, you see lights and colors that seem there just to torture you. Keep breathing, in and out. It'll be over eventually. This can't last forever, right? This description may sound like something out of a nightmare, but it's a reality for many people all over the world. I'm Bree.
And I'm Christiana.
Have your migraine toolkit ready because
you're about to hear something strange.
Welcome to episode 18, The Strange History of Migraines. Alright, as always, I'm going to start by shouting out my sources, and this is a momentous occasion, because we don't have Wikipedia. Making Modern Migraines Medieval, Men of Science, Hildegard of Bingen, and the Life of Retrospective Diagnosis, an article entitled Migraine History, Migraine, a Review on its History, Global Epidemiology, Risk Factors, and Comorbidities, History of Headaches, How Migraine Treatments Have Changed Over Time, Migraine Again, 11 of the Most Famous People with Migraine Throughout History, Association of Migraine Disorders, What is a Migraine, John Hopkins Medicine, Migraine Headaches, Headache Australia, Medical News Today, How the History of Migraine Treatments Have Changed Over Time, and Reddit.
Good old Reddit.
All right, so I want to give a quick disclaimer and content warning here. Disclaimer, neither of us are doctors, and none of the info in this episode is meant to be taken as medical advice. If you have questions about migraines or headache disorders, please ask a doctor.
Yeah.
Also, content warning, there's going to be a discussion pertaining to suicide and suicidal ideation. We'll put the hotline numbers in the show notes in case anyone needs them.
Yes.
So, also, this episode's in June, and June is Migraine Awareness Month. That's why I chose this topic.
So welcome to June, friends.
Welcome to June, as we say in April.
In April, yeah, when we're recording this.
Yes. All right, so what do you know about migraines, and have you ever experienced one?
Yes, I know more through being friends with you. Before that, I knew they were really bad headaches, but that's all I really knew of them. Yeah, I understand at this point more than I did. Like, I know they're much more than, quote-unquote, just a headache. I still don't know a whole lot about them. Like, I don't know medically, physiologically, like, causes or anything like that. But as to whether I've ever had one, I don't know. I've had, the closest I can say I've had is there was a point where I had a pretty good headache, but the thing that got my attention was half of my right eye went completely, only half of the eye went completely fuzzy.
Okay. Which
I couldn't figure out if that was a migraine thing or if that was just like a weird, I just had a regular headache. Because it didn't feel like migraine pain as it's been described to me. So I was like, I don't know what this is.
So as you're going to learn today, there's actually a lot of different types of migraines. I mean, I can't tell you if you had one or not.
Sure.
I'm not a doctor. I don't have a degree in that part of the brain.
Yeah.
In that kind of brain stuff. So one of the reasons I chose this topic is because I have dealt with migraines since I was 4. And also some of the old-time remedies are just straight up wild. Yeah. But I want to give some background information on what migraines are.
Yeah.
That way it just kind of helps make everything come together.
Mm-hmm.
So any more thoughts before we get into some of this background?
They are a strange medical diagnosis.
They are.
It's a very strange thing to occur.
So let's start on information about what exactly migraines are, how they look, especially like how they're described in this current time.
Mm-hmm.
First, I'm going to go into, there's some lingo in the migraine community about migraine versus migraines versus migraine attack.
Oh.
I believe that in the migraine communities, migraine is the disease.
Okay.
So the like quote unquote proper lingo is migraine attack.
Mm-hmm.
Now, I don't use that, and for some people, it does help kind of separate it from the headache that the migraine is a neurologic disorder. The attack is what people think of with the pain.
Yeah.
That's how I'm taking it. But I also just call them migraines because...
Yeah.
So, but there's people that are very, very like firm on that, which is
Mm-hmm.
great. If that is how you describe your experience, go for it.
Sure.
So the word migraine comes from the Latin hemicrania. What do you think that means?
Well, crania would be brain or head, and hemi is like partial, so like I think of hemisphere, so like half of the brain or
Yes.
part of the brain.
Yes. Yep, you're correct. More than 1 billion people worldwide are affected by migraines, so it is one of the most common neurologic disorders. It can affect people of any age or gender, but is most common in young adults and females. There are a lot of comorbidities. So comorbidities are co-occurring things with another disease. So this can range from sleep issues, sleep issues to stress, all the way to suicide. So I don't have a source to back this up, but I remember reading or hearing somewhere that like the top 2 causes of death connected to migraines are stroke and suicide. So this is another reason why we're putting this warning in here.
Yeah.
There's a couple different types of migraines, which you kind of alluded to earlier by accident.
Oh.
You'll hear migraines referred to as episodic. These are migraine attacks that people who have episodic migraines will have less than 8 headache days a month.
Okay.
So this could be people who maybe have 1 a month
Okay.
or have like 2 or 3 migraines a year, right? Those
Okay.
are episodic.
So pretty brief bouts.
Yeah,
Okay.
as I understand them. And then chronic. So chronic is 8 or more migraine days a month. So this is 8 or more, like, I think attack days.
Okay.
We'll talk about that in a second. 15 days a month are impacted by symptoms. So even if someone isn't currently having a splitting headache, they can have other symptoms. We'll talk about that a little bit later. There's also status migraines. This is migraines that last for 72 hours or more, intractable, and this does not go away for a prolonged period of time, and they're resistant to treatment.
When you say like a status or intractable, so it's like 72 hours or more, does that mean full 72 hours of that
Are the attack phase.
That's the attack? So that's
How
like
I understand it.
That's the painful.
Yeah.
Like it's not other symptoms. It is. I shouldn't say it's not other symptoms, but that's where you're getting that like quote unquote classic thumping headache. Okay.
That's how I understand it. I'm not a neurologist, so I could be wrong.
Sure.
But that's how I understand that. These terms that I just used are the ones that are usually thought with headaches that are associated with pain, right?
Yes.
There's other kinds of migraines too, though. So there's vestibular migraines. Those are ones that are like kind of described as you have all of the other side effects, but none of the pain.
Oh.
So you're going to be like vertigo-y. You're going to have aura usually. We'll get into that in a second. You're going to have like the nausea. You're going to just feel weird.
Huh.
The light sensitivity, the sound sensitivity, but you're not going to have the throbbing headache, or you could have head pain, but it's not going to be severe.
Okay.
I am just saying a couple of these. There's so many more. There's also something called abdominal migraines. These are things that are present in children, and they tend to develop more of the classic migraines later on. There's a really strong connection between the vagus nerve, which runs from the brain all the way to the stomach. It goes through a lot of your vital organs. It's really, really important in like the fight or flight, actually.
Okay.
The fight or flight response and the sympathetic and the parasympathetic nervous system. Sympathetic nervous system is fight or flight. Parasympathetic is rest and relax and digest. So it sends signals because it goes all the way through your body. It goes through your stomach and beyond. So a lot of times when people have attacks, they get really nauseous and then they bring up and then they feel better because it's like chilled out the vagus nerve a little bit. That's
so
how I understand it.
So it's like the stomach more so that's affected than
In abdominal migraines.
in abdominal migraines.
But in classic migraines, you can still
sure, you
get
can
very,
still
very sick.
Yeah.
There's also ocular migraines, which is they really only affect the eyes from what I understand. I don't know as much about them. I've never experienced them.
Yeah.
I've experienced vestibular, classic, and abdominal as a child.
Okay.
And then hemiplegic are ones that are, so once again, there's a phase called the aura. We'll get into that in a second. They have very, from what, the way it's described, it seems very stroke-like.
Yeah.
It's like half of your body goes numb.
Ooh.
There's motor weakness on half of your body. So people will go to the ER thinking they're having a stroke.
Yeah.
And in reality,
that's
they're having...
terrifying.
Yeah,
Oh
so
God.
there's some kind of tie between strokes and migraines too. So let's talk about the symptoms a little bit because these are going to come up in some of the historical accounts. Migraines are not just about head pain. This is only one part of the disease. So some common symptoms, this is not an exhaustive list, are sensitivity to light, sensitivity to sound, sensitivity to movement. I got this quote from migrainedisorders.com. Migraine can impact the entire nervous system. This is me talking now. It's more than just can. It does. This means that many people experience symptoms in various parts of their body. One may think these widespread symptoms are not related, but in fact, migraine could be the underlying cause. So here are some common symptoms that aren't often associated with migraine, and some of these are a little out there. Imbalance. So like you can't keep your equilibrium.
Yeah.
Difficulty finding words.
Okay.
Ear and sinus pressure, sleeping poorly, and feeling anxious. Because remember, your nervous system is impacted, so it's going to affect your sleep. It's going to affect your moods.
It's making everything go
Yes.
haywire.
And technically, there are 5 stages of a migraine. It's important to note that not everyone's going to experience all 5 every single attack. So the first one that's experienced by most people is the prodrome. This is technically the first phase, and for a lot of people, it occurs before the pain actually starts. The amount of time between the prodrome and the pain starting can really vary depending on the attack and the person. I've heard stories of people having anywhere from like 30 minutes, 2 hours a day. Usually, I can tell how bad a migraine is going to be by its prodrome. By what kind of symptoms.
Okay.
I'd imagine other people probably have similar experiences to that.
Yeah.
So what are some signs and symptoms of this? Excessive yawning is a sign of a migraine coming on. That's strange, right?
I have a weird thing.
Go for it.
So, I wonder if this is a little bit of a species crossover, because bear with me, I'm coming to a point here. There is in animals, when they're starting to get stressed or anxious, sometimes they'll yawn a lot. Like you'll see, and you can usually tell when it's like a big sleepy yawn versus because their mouth is very tense, their ears might be pinned back, and if migraine affects the nervous system and it's causing anxiety spikes, it's just that's just where my brain went. I know that's very strange.
I wonder if it has to do with the oxygen levels in the body. That's what yawning does. It increases oxygen levels.
Right, that's true too.
So the nervous system's like, oh my god, and the body's like, oxygen.
I need more air. That makes sense too. That's probably more so. It just is a weird tie-in, I thought.
No, that's interesting. So depression. Sometimes people will... You're going to see a lot of mood stuff. Like mood, not moon. A lot of mood stuff tied into migraines. There's been times where like my mood just drops. And I'm like, why do I feel this way? Or why am I really anxious and cagey? And the next day I'm like blinded with a headache.
Yeah. You're like,
that's
why.
To the point where other people have noticed and been like, you weren't yourself. And I'm like, yeah, I don't know why though. And in retrospect, it's like I've had this disease.
You're like, oh crap.
For 28 years. I should know. But anyways, fatigue. So people just like horribly tired out of the blue. Slowed thinking. So I usually describe this as trying to think. Have you ever tried to run in water?
Yes.
Yes. It's like
Feels
trying
like
to run
sludge.
in water. It's like I can't. Like your brain is just moving at a slower pace. I also personally, and I apologize, I'm going to talk about myself a little bit in this one.
No.
I get these weird bursts of energy. You've probably gotten texts from me like, I cleaned the whole house. I'm like, I don't want to pull in like psychology words, but I'm almost hypomanic at that point.
I was just going to say, it almost sounds like, and again, neither one of us are doctors, but like being manic.
There are a lot of one of the more often comorbid mental health conditions is bipolar disorder.
Oh, interesting.
Yeah.
So is that like...
It might be the way the brain's wired.
Okay. It is when it's comorbid. Is that... I meant to clarify this earlier. Is that like goes hand in hand with
Yeah.
or caused by?
No. Often hand in hand.
Okay.
That's a good clarification. I think it's a common comorbidity. I'm not entirely sure, but I'll get this big burst of energy where I'm just like, I can do all the things. And then the next day I'm dead.
Yeah. All the spoons are gone.
All the spoons, well, and my head's pounding.
Yeah.
The duration of this phase can really vary, like we said earlier. All right, so we're going to go into the aura. This is not experienced by everyone. From what I understand, if you experience this, you have a higher stroke risk, which is scary.
Yeah.
It can be present throughout all of the phases. It doesn't just go prodrome, aura. You can get your aura during your prodrome.
Okay.
And for a lot of people, it lasts all the way through the end of the attack and the following phases.
Okay.
So this is characterized by sensory disturbances, and it can look different from person to person. There can be like the illusion of changes to vision. So people will see sparkles, glitter. I tend to see glitter. I'm like, oh, this isn't good.
Oh, no.
Things may seem like Alice in Wonderland syndrome. Things seem to get bigger or smaller.
Yeah.
Sometimes they'll be kind of like people and things don't look right.
Okay. Just some little detail is off.
Like an uncanny valley feeling. It's like you're looking in the mirror and you're like, I know that's my face, but it doesn't feel right. Something's wrong with it, and I can't put my finger on it. It's in a horror movie when you're waiting for the reflection to move back to you.
Change. Yeah.
Also, phantom smells. So, have you ever been hanging out with me and I'm like, do you smell that random smell? And everyone's like, no. And I'm like, well, either I'm having a migraine or a stroke.
Yeah. Oh, God.
And confused thinking.
Sure.
Sometimes there's auditory stuff in here too. So the brain gets confused when it comes to what it's hearing and all of that stuff.
Like auditory pareidolia.
Yeah.
Almost. Yeah.
So our next phase is the attack phase. This is experienced in many migraines. However, there are types where there's no pain or very little. So we're talking like the vestibular ones from earlier. So this is called the pain phase. This is the one that most people think of when they think of a migraine. The duration varies. For some people, it can be like a couple hours. For some people, it can be days. Just depends. So,
Yeah.
it's a throbbing headache. A lot of times it's on one side, or it can travel across.
Ooh.
A lot of people report nausea and vomiting here. Continued sensitivity to like everything. This is where your head hurts and your light hurts and your sounds hurt and touch and hurts and that kind of stuff. The next one is the postdrome. This is often called the migraine hangover.
Okay.
So most of us call it because that's what it feels like. You're really fatigued. Sometimes your head will feel sore. This is a little trippy. My scalp hurts afterwards.
Yeah.
It aches. Like it feels like my hair got caught in something. Or when you have a ponytail in for a very long time and then you take it down and like your head kind of aches. That's kind of what that feels like.
I mean, it makes sense if it's messing with the entire nervous system. Everything's gonna be. So it does make sense. Yeah.
And then this can usually last about a day, but it really does depend on the person. Technically, there's a fifth phase, the interictal, I had to write that out, phase, between attacks. So many people report anxiety about not knowing when the next attack will begin. So it's just like, great, like what's going to set it off?
Yeah.
And there's a lot of things, I didn't go too far into this, but there's a lot of things that can trigger a migraine and people are more sensitive to. So I could imagine that anxiety is going to be heightened about that in this phase because it's like, crap, did I eat something I shouldn't? And so we won't go into all the triggers.
When, this is maybe kind of a stupid question, but just for my sake, is when the vomiting can occur, if that occurs in the midst of an attack, do you think that's more like a pain response? Because sometimes people can be in like so much pain that it's just like their body doesn't know what to do in it. Or do you think it's more related to like stimulating that vagus nerve, or maybe
probably
both?
If I had to guess, if I'm not a neurologist, but if I had to guess, I'd probably say both, because you also get like a lot of people get to the point where like if you move, you throw up.
Yeah.
Like I've been in the place where I'm like, oh, I have to go to the bathroom so bad, but I know if I move my head, I'm gonna puke.
Yeah.
But then you feel better if you puke sometimes.
Huh. I think maybe. Well, you said earlier with especially like children, if they clear all that out, then it kind of knocks that nerve back a little, or not knocks that nerve back.
It does something to it.
Does something to it, and it makes it feel better.
We're not doctors. The best guess of an adult. So let's get into the fun stuff. So this is kind of the thing that this is the part that made me want to do an episode on migraines. Okay. Because we're going to get into the strange history of what people thought were causing them in the past and how they treated them. And some of these are a little off the wall.
Possible trigger warning for lobotomies.
No.
Wow.
No, we're going to talk about trepanning, though.
Oh, okay.
I'm sure they probably did lobotomies for migraines because, like...
The 1950s.
Like, my wife is acting a little strange. Can you, like, shove an ice pick up her eye? History of migraines and migraine treatment. All right, so reports of headaches go really far back. So how far in the history of the human race do you think people have been reporting throbbing headaches?
I feel like it's had to have been since, like, the beginning.
Yeah, probably. 7,000 BCE, before Common Era, there were signs of ancient neurosurgery evident.
Ooh.
Yeah, there have been skulls found from the Neolithic period with trepanation. It's thought that that might have been widely practiced at that point. So do you know what trepanation is?
Isn't that trigger warning for medical procedures here, friends? Isn't that like essentially where a hole is drilled?
Yes.
In the
part of the skull is removed to remove pressure.
Yeah.
Which, you know what? I'm not gonna lie. In like the moment of a really, really intense migraine, I've thought about it. I'm like, maybe they can just put a hole in here and release the pressure and it'll be better.
Yeah.
Not how it works.
Yeah.
But like in the moment, I'm like, you know what?
When you're desperate for any form of relief.
Yeah. See, you've got the next one, right? It's removal of part of the bone from the skull. This may have been performed to release demons and other malevolent entities from the head. They were thought to cause headaches, madness, and epilepsy.
Yeah.
I don't have a neurologic disease. I have demons.
Yeah. I'm sure that's probably how it feels sometimes. Like,
I made the joke with you that, like, knock on wood, my body is like possession proof.
Yes.
Because I have multiple chronic illnesses. They'd get in there and they'd be like,
hop right back out.
No.
Like, just kidding.
Hard pass. I don't want to. It's like, no.
Yeah. You sure you don't want to stay for tea? Nope. They're gone.
They're gone.
All right.
So
demons don't like you. Ghosts don't like me.
That's a pharaoh button. Demons don't like you. Ghosts don't like me.
Correct.
All right, we're keeping all that in. So apparently, according to my sources, this was still not demon exorcism. I'm not talking about that right now. Trepanning was recommended until the 1700s. That's long ago, but that's not that long ago.
Not that long ago. No.
In Mesopotamia, it was believed that an evil spirit attacked people and led them to have terrible headaches and head pain. And then archaeologists have found skulls with the parts removed, which were attributed to doctors at the time, recommending that parts of the skull be removed to relieve the pressure. That's what we were talking about earlier. So it was in different areas. So we had 7,000 years to 3,000 years BCE. Mm-hmm. How long of a period is that? 4,000 years?
4,000.
So that's like 4,000 years of ancient doctors drilling holes into people's heads.
That, I want to just point out here, friends, first of all, that shows you how bad this has to be. Because people are willingly like,
yeah,
for the love of God, stab me.
Yeah.
And I just want to point that out. Like,
yes.
I also have a quick question. Was it always the same part of the skull that was removed?
I don't know.
Okay. My brain instantly, if I think of that, goes to like the temporal bone because that's a pretty thin part. But that's also like right up by your eye. So I don't know that they would want to do that. And they probably wouldn't want to do right in the middle of your forehead because, like, it's right in the middle of your forehead.
We have to see if we can find pictures of these things, but...
Weird question.
The pain is, like, in the temple areas and it moves over, though.
So maybe the temporal bone... Because that, like I said, that is a pretty thin part of the skull.
Yeah.
It's not, like, right next to your eye. It's not, like, in the corner of your eye, but it's there. So
I wonder... So I look at this a little bit. I got nerve blocks for years. And those are shots. And they were, like, above my eyebrows, at my temples, and at, like, the occipital lobe.
Okay.
And I wonder if that's places I did that too.
Maybe. Occipital lobe is the back of the head.
Yeah, those were...
I love anatomy.
Yeah.
It's weird.
So there's reports of migraines going back as far as 1200 BCE in Egypt. And then I thought this was going to be an easy pronunciation episode. I was wrong. So we're getting into some of like the ancient doctors now.
Okay.
So we have Razi, who lived between 854 and 925 BCE. He was an Iranian physician. He had a whole section devoted to headaches in his book. He described in detail what is now known as like cluster headaches and migraines.
Okay.
And suggested that a severe and sudden headache may be the sign of a stroke. So he was like on to stuff. He was putting the things together.
That's crazy.
And then
that they knew they probably didn't know the cause of a stroke
No.
at that point, but to know, like, oh, this is a collection of symptoms, that means this.
I don't think we give ancient people's enough credit.
Yeah. So interesting.
It's like, that person had a bad headache, and then they dropped over dead. So did that guy. There must be a connection.
Yeah.
400 BCE, Hippocrates wrote on auras that can precede a migraine, along with the relief that can be experienced after vomiting.
Huh.
So the historical person credited with the discovery of migraines was Aretaeus of Cappadocia. From the 2nd century, he described head pain on one side of the head or both, and the association with vomiting and the time between migraines. So now we have things are starting to compile. It's like they're taking work from earlier people and adding to it.
The stages are starting to form.
Yeah, he divided headaches into 3 main categories. The first category was called
Cephalalagia.
Cephalalagia. I took 4 years of Latin. I didn't take any Greek.
It's okay.
And was described as mild and short-term headache. Category 2 was called Cephalia, and it's a type of headache that is chronic and more severe.
Okay.
Category 3 was heterocrania, a sudden headache on one side of the head accompanied by nausea, vomiting, light sensitivity, and symptoms of the eyes, sweating, and changes in perception and smell. So now we're getting migraines, like for reals.
Yeah.
So then we have Galen, who is a Roman and Greek physician, surgeon, and philosopher. What a resume.
Yeah.
He is from 129 to 216 Common Era. So now we have crossed into the Common Era.
Okay.
So, or AD, depending on.
So this would be the 1st century.
Correct.
Okay. Or
Second
Second century.
He also wrote about migraines. He's actually a pretty famous, if you ever had to translate any Latin stuff, you'd come across his texts.
Okay. I also like his name.
Galen?
Galen.
I think that's how I say it. He believed that they were caused by vapors rising from the stomach to the head. Huh. So there's that stomach-head connection.
Yeah.
So then we have Albucasis, was an Andalusian-born physician. He was born in 936 and thought that one-sided headaches could be treated. Oh, here's some of our here guys. There's going to be a trigger warning about ancient medical procedures again. Just a heads up.
Yes.
He thought that one-sided headaches could be treated by applying hot irons to the head. It gets better. Or applying garlic to the site via an incision in the temple.
So, would the incision just be skin deep?
I don't know. Are they just cutting it and just, like, having an open wound
like packing it
stuff?
Yeah. Ugh. Like packing it like a tincture. Or not a tincture, but, like a poultice.
And it's garlic.
That probably burns, I would imagine, in a cut.
It's a vampire test.
It is. On to you,
Vampires. The Middle Ages brought other interesting treatments for migraines. These included bloodletting and witchcraft.
Yeah. Wait, witchcraft was a treatment?
Would go to like
Like
practitioners,
the quote unquote village witch.
Yeah.
Just was like, here, eat some bark off
eat
this
some
tree.
berries.
You'll probably feel better.
But
they're like, she's a witch.
But like there are some natural or treatments, so like feverfew is one.
Mm-hmm.
They could have been giving them things like that.
Yeah. Or the like I said, the aspen tree is
Eat
aspirin.
this bark.
Huh?
Like, man, why does this bark make me feel better? So my sources describe these treatments as ineffective.
That's fair.
I thought it was funny. It's like, man, we're throwing shade. Also in the Middle Ages in Europe, treatments included drug-soaked poultices, opium, and vinegar solutions. I couldn't tell if this was one thing.
Or like 3 separate.
Like here, have a poultice with a mysterious thing in it, drug-soaked.
Do some drugs about it.
Have some codeine. Did the codeine exist yet? No, it didn't. Have some opium.
Have some, yeah. What was this? The Middle Ages. So I guess I don't think laudanum was the thing yet either.
Opium it is.
Opium it is.
Have some hard drugs.
Literally do some drugs about it.
And vinegar.
Yeah.
I wonder if that, like, the drug was the opium, vinegar, and...
Like everything was just kind of...
Is the vinegar maybe disinfectant?
Maybe.
To disinfect your head?
Yeah, probably.
Oh my gosh. I can't imagine. I don't know. Anyways, Thomas Will, so we're going to go to the 17th century, we're moving up in the world, published a hypothesis that megrim, and this is spelled M-E-G-R-I-M, was due to dilation of blood vessels in the head. This is the first vascular theory. Mm-hmm. So we're starting to get closer to, like, I think a lot of the earlier stuff was let's look at the symptoms and kind of go from there.
Sure.
And this is they're getting more knowledge on how the human body and human anatomy works more like intimately, and it's like, oh, we're noticing, like, so if I'm a little headachy right now, like if I would put my finger to my pulse on my forehead, what I'm doing right now, or my temple, I can feel it constricting differently.
Yes.
Like I can feel it.
The vein, like the physical veins in there are
pulsing.
You can feel your pulse. Yeah.
But like more intense than you normally would.
Yes.
I think I don't do that when I have a headache, so maybe it's always that way. In 1873, it was proposed by Edward Living that migraines were due to a nerve storm evolved out of the optic thalamus. So we're getting to the importance of the occipital systems. And this person has a fun name. In 1898, Mobius stated that dysfunction of both the brain and the blood vessels were necessary to produce a migraine. So we're like getting our crap together.
Yeah.
So we're going to be getting more into the modern. Graham and Wolfe reported that ergotamine tart could be used to relieve migraines in the late 1930s. What is this, you say? Well, I didn't know either, so I had to Google it.
What is it? I know what ergot is. That's a fungus.
Yes, it is.
And I did not read ahead. Well, I kind of did, but I already knew that.
My brain yeah. Good.
Amine is like the end of a drug. Sorry, I don't want people to know what I do for a living.
You're a serial killer.
Yeah, well, yes, we all know this.
That's how you poison your victims.
Yeah. But yeah, ergot was in the, that was one of the things that they thought could have been involved with the Salem witch trials.
Yeah.
Yep. Was not. But
so, yeah, because I was like, it's a kind of fungus, but I don't know how it was, like, refined and how it was supposed to help headaches.
Yeah. Because you were
the next part
busy
says it.
Going crazy. I'm sorry.
Your head doesn't hurt if you're not in reality. That's probably not true.
If you're tripping balls.
If you're tripping balls, that your headache... Do you know what I think of when I think of that? That scene in Hell of a Boss. And what is that?
No. Sorry.
No. Oh, what's the name of that, like...
Oh, when
like,
they're...
the team, the
dorks.
The dorks. The Timu X-Files. Oh my goodness. What's his face is having like a Phantom of the Opera trip. Meanwhile, Blitz is having like the worst experience in
the worst like trip of his life. Watch Hell of a Boss, guys.
My ears are ringing now.
Oh, I'm sorry. I was laughing really loud.
The imps know about us. Okay. So apparently, let's go back to ergotamine. This worked through the vascular constriction of dilated blood vessels. I think I am, once again, don't quote me, I'm not a doctor. This might be similar to how like triptans work. And that's why caffeine works for migraines too, because it constricts.
Okay.
According to one of my sources, it's still used today. Don't know if that's true, and I have never had that been offered to me as a rescue.
Yeah.
So a rescue is a headache. A rescue is a medicine you take once you are noticing the headache starting to kind of try and get rid of it.
Sure.
You also hear them called abortives. Preventatives are what you take daily to try and prevent the migraines.
Okay.
So apparently, it comes in the following forms: oral pills, inhalers, suppositories. I don't want to know where they're putting them.
No, thank you.
With caffeine. And IV infusions.
Huh. Something. That's
my God.
really, really interesting to me that, I mean, of course, like I said, they would have to break it down to take away the negative effects, right? But, like, that's fascinating to me. I love weird medical stuff.
Let's go on a slight tangent for a second.
Yeah.
So, you know, I can't think of the person's name, the scientist that discovered LSD.
Oh, man.
He experimented on himself.
Yeah.
So, like, you can still see his journals.
Is he the one? No. That's a different thing. I feel like there was a person, but I think it was different types of drugs where he would draw his self-portrait on different, and LSD was one of them.
I know who you're talking about, and I can't think of who it is.
Okay. I don't think it's that same guy, though. I don't think it's the same person.
Neither of us do drugs, so we are neither of us do drugs or work in any kind of substance use types of places. Like, that's not an area of expertise for either of us, so we know nothing. But, like, I vaguely remember in, like, a science textbook reading, maybe it was a psychology textbook, reading whoever this doctor or whatever the scientist's name was, his experience of riding a bicycle on LSD.
Oh, no. Oh, that's, I feel, a very not good decision.
I think that's what that was. Anyways.
Oh, man.
So
Crazy.
kind of going back to this, worked by increasing serotonin levels and lowering inflammation. They do give SSRIs to people with migraines because a lot of the older classes of migraine meds were kind of found out by accident, the preventatives. You have to be careful with serotonin because it can constrict blood vessels. It's not good if you have hypertension, and there's other issues. You can, if you're susceptible to serotonin syndrome.
Yeah.
And there's also a heightened risk of dependence.
What we're saying here is talk to your doctor.
Yeah, don't go buy like Zoloft off the street.
Yeah, please don't do that, friends. We're not even slightly recommending that.
I don't even know if they give Zoloft for migraines.
Oh, I have no idea.
Okay, so then back to Mr. Wolf here. Harold Wolf created an experimental approach to exploring the brain in 1950. I don't know what that means, and I don't know that I want to know. He proposed that abnormalities with blood vessels might be connected to migraines. In the late 1960s, serotonin is found to be helpful in treating migraines. And then in 1972, 1990s, Dr. Patrick Humphrey built on the 1960s research to develop triptans. So triptans is probably one of the most, if you go to the doctor with migraines, this is one of the first things they're going to treat you with as a rescue.
Okay.
So Imitrex, but there's different. So there's like rizatriptan, sumatriptan, naratriptan. There's like 7 or 9 of them.
Okay.
All right. So current treatments, we're into the less weird territory, but some of these are just kind of sciencey interesting.
Sure.
So the first couple classes I'm going to talk about of preventatives are all things that were used for other different diseases that they started to see, from what I understand, like in research, like, oh, this person has migraines, they decrease too. So the first one we have are beta blockers. So these are used to slow the heart rate and relax blood vessels, used as a preventative.
Okay.
Antidepressants, SSRIs. We talked about earlier the anti-inflammatory workings of those. And then Topamax, because apparently brains with seizures and brains with migraines are similar. So those are the classes of meds they'll try first generally. And then there's some newer classes of meds that are just for migraines. We'll get into them in a second.
Okay.
So triptans, we talked about them. Those are rescues. So Botox injections are another big one.
Okay. I've always been curious about that.
I think that was another thing where it's like people were getting Botox for like cosmetic reasons. And like, my migraines got better.
That's why it's always been so interesting to me, because I have always known Botox to be cosmetic. Yeah. And I have heard that too, of more recently people using that for migraine purpose, which is like wild.
I know it paralyzes some of the nerves, right? That's how it works.
Okay, which would make sense because your nervous system can't be going flying off the handle like it wants to presumably during a migraine or before a migraine attack if it's literally paralyzed.
Yeah. And then there's also kind of moving into nerve blocks, which are...
Sure.
You can get anywhere from like 2 to 8 of them in your head.
Okay.
In 2019, and this gets into some really cool like research on the newer classes of meds, which are really helpful for a lot of people. Nerve interaction had something to do with the signaling of a molecule called CGRP, and this plays like a major role. So the newer classes of meds are CGRP antagonists. So to my knowledge, there's 3 injectables and 1 pill. So the pill is Ellipta, Emgality, Amavig, and like Amjoy or something like that. I can't think what the third one is. Emgality and Amavig.
Okay.
Are the injections.
Okay. And did you say this is a preventative or this is
preventative?
This is a preventative. Okay.
Now there's all kinds of ones that are newer that are rescues. So Nurtec is a newer rescue.
Okay.
There's one with a U too, and I can't think of what it's called. So in 2013, a Cerna device was FDA approved. So this is another kind of weird brain thing.
Okay.
It delivers short magnetic pulses to the back of the head, which causes electrical currents in the occipital cortex. This helps reduce or get rid of the effects of migraine with aura. There are also several other FDA approved. So this isn't like someone selling them out of their car. This is like the FDA did tests on them.
Yeah.
Because I'd imagine the brain's very, very magnetic in its nervous system.
Sure.
So it's probably like a heart
electrical
reset.
Pulses. Yeah. That's really interesting.
There's also, we're not going to get into care too much here, but there are vitamins and minerals that are supposed to be better for migraines. if you go to the doctor, sometimes they'll say things like try chiropractics or try acupuncture or massage. Some of the more holistic stuff also includes like diet, because there are certain foods that trigger things for people. And I am using headaches and migraines interchangeably here. That's not actually correct.
Okay.
It's just
But that's
what I'm used to saying.
You're used to, that's your terminology.
That's not technically correct, but... All right, so we're going to go into some famous historical migraine sufferers, not in any specific order. So let me know if you knew of any of these people. You would know who they are, but if they had migraines.
Yeah.
Julius Caesar.
Dang.
And this is all, like, retrospective. Like, obviously, they probably weren't diagnosed at the time.
But looking back at historical record, we can see, like, oh, this is likely what this was.
Yeah. Napoleon Bonaparte.
Huh.
Harriet Tubman.
Oh, my girl. I love her.
These next two are kind of funny to be next to each other. Ulysses Grant and Robert E. Lee.
Man, that's... Oh.
Can you imagine being in a Civil War battle with a migraine?
That was instantly where my brain just went. Like, the cannon... Ugh. Brr.
Woodrow Wilson.
Oh.
JFK. Mary Todd Lincoln. Sigmund Freud. He's
Ironic.
taking cocaine for that. Yeah. Are you sad? Have some cocaine.
Do some coke about it.
Does your head hurt? Have some cocaine.
He was also tripping balls.
Is your uterus wandering around once a month? Have some cocaine. Nietzsche. Friedrich Nietzsche. He's a fascinating person.
I've never know how to say his last name.
I think I'm saying it right, but yeah, Friedrich Nietzsche.
Okay.
He's a fascinating person.
Yeah. Wild.
Charles Darwin.
Hey, the man.
St. Paul. I have no clue how they could have put that together, but I don't know.
Yeah.
Thomas Jefferson. I knew that because I went to Monticello. Okay, this next person is someone I'd like to do a whole thing on. It's Hildegard de Bingen, and she wrote of visions, and they were kind of thought to be migraine with aura. She was this really influential abbotess.
Okay.
And like almost like a seer.
Huh.
Like she was like able to rise as high as she did. Probably calling her a seer would be wrong, but like she was a just really well-known abbotess.
Yeah.
And she was only able probably to rise as far as she did because she had these visions.
That
were
really
probably migraine with aura. So I have some extra things that didn't fit, and then I have this really fun section called like the soapbox. All right. So there are still people.
Sorry, that just struck me. I have this real fun section called the soapbox. It struck me funny. Okay.
So there are still people that think migraines come from demons who need exorcised. I'm just gonna leave that one in. All right. Are you ready for some of the best of the worst unsolicited advice?
Oh, hit me.
/ things not to say to someone with a chronic illness, or 2 or 3 or 4.
Seriously, guys, please don't.
Well, we'll get into what to say. So when you have a chronic illness, you get a lot of unsolicited advice, and a lot of times it does come from a place of people trying to be helpful.
Yeah. People are caring.
But that's hard to remember in the moment.
Yes.
All right. So common ones that I got off of Reddit or that I've heard is drink more water. Which, I mean, drinking water is good for you, but it's not going to cure a pain disease.
It's not going to, yeah.
Try not to think about it.
Oh, okay.
It's like, yeah, I'm going to try to think about the throbbing pain in my head or the other pain in other places in my body.
Yeah.
Try to lose weight. I haven't gotten that one.
We're gonna, oh, good. I was going to say what? Excuse me.
Try X-Cleanse or diet.
Nor.
Now, I have heard people say the Mediterranean diet is better, and there are, like, preservatives can be triggers for people.
Sure.
So, I'm not saying that there's not validity to some of these. Like,
yeah.
Yes, drink water. It's not going to cure. Changing your whole diet's not going to cure it either.
Yeah.
Yoga. Once again, yoga can be very good if you know your body.
Mm-hmm.
But it's not going to cure it.
Yeah.
Exercise. Within reason,
again.
Same. You need to exercise more, okay? Cutting your hair. I got told that many, many times. Because of the extra weight on your head.
Like, okay. I don't know why that just is...
I will say that right now my hair is almost tailbone length.
Yeah.
And about 7 years ago, I cut it to my shoulders.
Mm-hmm.
There was no difference in headaches or migraines.
Like, I get if you have hair. I've seen...
really thick hair. And
yeah. Or what was it? The woman with, like, the longest hair in the world had, like, 22 feet long of hair. Sure.
That could cause headaches. It's not going to cause you to have a migraine disorder, though.
Yeah, no.
I don't think so anyways. You need to stop being so stressed.
Okay.
I had a neurologist tell me this. My mom's cousin's hairdresser's ballet teacher did XYZ and it cured them. Essential oils, they can help. I do have ones that I use that might help relax my muscles a little bit.
Mm-hmm.
Not going to cure it.
Mm-hmm.
Try this random food, mineral, spice, vitamin that there's been no empirical research on. There are some there are some that there is empirical research on.
Mm-hmm.
But
what
it's
is it turmeric?
Turmeric's good for a lot of things. So
yeah.
is B2, so is
okay.
magnesium. There are some that have empirical research.
Yeah.
Because turmeric has anti-inflammatory.
Okay. That's
properties.
where that one comes from then.
Stop eating this thing. Okay. So the thing with that is not everyone has the same trigger. I've had people tell me stop eating chocolate. Chocolate's not a trigger.
Not a trigger for you.
For me.
Sure.
People will be like, stop eating that specific. I literally had someone tell me to stop eating peanut butter because it triggered their sister's migraine or something. And I'm like, well, it's great that they found that for themselves.
But that's not
peanut butter does not trigger for me.
Right.
You're not trying hard enough. You need to do more. I also, soapbox. When I was in high school, and I was very active in the church I grew up in, I was told to pray harder and be a better Christian, and then maybe my migraines would go away.
Guys, stop saying that.
That's a hard one. Like, and especially I struggle with when people come at things from a place of religion. And this is, if I can join you on I don't get this through chronic pain, but I've had people about like my mental health disorder or my, grief and different things like that. It's like a lot of times, I try to remember that when someone is saying, I'm going to pray for you, or they, I hope, mean that from a very well-meaning, deeply loving place within them, because to them, that is something they deeply believe in a spiritual power, and that's to give themselves that, to give that part of themselves to someone else is very meaningful to them. In particular for people who maybe aren't as religious or don't follow that particular religion, especially when you're right in the middle of a really hard struggle, that's not helpful.
Yeah.
And I'm so sorry to say that. I don't have a nicer way to say that.
No, and I can see where you're coming from. I didn't mean to cut you off. I'm sorry.
No, you didn't cut me off.
Right? And I think saying, I'll pray for you is very different than saying you need to be better at your spirituality.
That's true, too.
Right?
Yeah.
Because I, in general, don't mind when people say that to me. Not everyone's different. I prefer if someone asks, can I pray for you?
Yes. Like, that's coming from a place of kindness versus victim blaming.
And it's getting consent.
Yes.
Like, can I do this action?
Yes.
And once again, like you said, it's coming from a place of wanting to help, which I think can be nice, but also you don't know the person's background. Maybe they had religious trauma.
Yeah.
But also telling someone you need to be better at your spirituality because it'll cure your headache.
That's so cruel.
Uncalled for.
You're not good enough for God.
Yeah.
Oh, okay. Thank you for that. That's awesome.
Spirituality and religion can be wonderful, wonderful supports and coping skills.
Yes.
And if you are someone who that is a part of, like, your practice, then by all means, incorporate prayer, incorporate scripture, incorporate what you do. Right? That's fine. But don't tell someone else what they need to do.
Yeah.
Like, there's nothing wrong with, most people are like, give it up to God.
Yeah.
Okay, well, that might work for you. End of story.
There's something that and this has personal meaning for me I don't mind keeping this in, with my own father, and he suffered from cancer, and I always have the thought in my head, you wouldn't tell a cancer victim, or not a victim, a person who is living with cancer,
patient,
that you wouldn't tell a cancer patient, oh, you're not praying hard enough. Don't tell someone with a chronic illness that, because it's still an illness.
I am willing to bet cancer patients have heard that, though.
Yeah, the sad thing is.
But no, I agree with you. Okay, so we're going to go to Reddit for a second, if that's okay. From our migraines, the thread was, what is the most annoying advice people have given you? This first one, you're going to love this one. I know it.
I literally have my phone flipped over, so I can't read ahead.
And I've been told this one, too.
Oh, no.
Having a baby will cure migraines.
Oh, for fuck's
How does that cure men with migraines, or people who don't identify as female, or people who don't have female reproductive organs?
You're right. Oh, God.
I've had people say this to me, or there's people that claim that, like, adult spicy time will cure a migraine. But there are people that adult spicy time will trigger migraines.
Yeah.
Now, I can see the endorphin and, like, the blood pressure change could probably I can see why people could make that connection, though, because you're having endorphins, which is going to dull pain.
Yeah.
If you are in a consensual relationship and you are taking care of each other, you will probably have endorphins that lower pain.
Sure.
Also, there's going to be a blood pressure change, so that might also affect the vascular constriction.
Yes.
Okay. Sorry, back to Reddit. Have less pain and unhappiness in your life.
Okay. Oh my god.
That is up there. Try not to think about it.
Okay. Can I go on another soapbox there? Because that reminded me. A smaller one.
A mini box.
A mini box, if you will. Don't think about, again, I'm coming at this from a place of mental illness. Don't think about your mental illness. When you're living with specific mental illnesses that can be triggered by certain things.
Also, this one's not in here, but I should have added it.
Or not.
And it was, are you sure it's not in your head?
No.
And it's like, that, well, here's my thing with migraines. Are you sure it's not all in your head? That's where my brain lives.
Friends.
Are you sure it's not in your head? I'm like, well, that is where my brain lives.
Guys, we're in 2025. Stop saying this shit. I'm gonna say it. Stop it.
It's like, yeah, man, you just pointed out the location with the organ that is having the major issues.
Yeah, correct. You just look at them and be like, well, it's the rest of my nervous system too, but, the brain's a pretty big part of that, so, like...
It's not the control center or anything.
Yeah.
All right.
Finger guns.
Get your blood flowing. Once again, I could see how, depending on where you are, it could change the constriction.
Sure.
Find God, get rid of the evil spirit attached to you. They wouldn't even inhabit you if they felt your head.
That's, correct.
We full circled that shit.
Oh, God.
And the last one, your doctor must be bad or your meds aren't working. So a lot of times, I don't know of many people that see a doctor, get a med, and never have a migraine again.
Yeah.
It's about controlling it. There's no cure.
And I feel like that is a hard one because sometimes, and especially, cut this out if you want, but I don't know where the line is here exactly, but certain peoples have a harder time being taken seriously by doctors. Mm-hmm. And I don't want to get any further into that. I'm not trying to yell at anyone. I'm not trying to get in trouble here, but sometimes, like maybe finding a new doctor, but that doesn't mean it's like, just because you had a migraine after your doctor said XYZ, that doesn't automatically mean they're a bad doctor. Mm-hmm. Like, yes, sometimes you have people that just don't fit with your vibe.
And if you have a headache or if you have a migraine, you're better off finding a headache specialist than a general neurologist.
Sure.
Nothing wrong with general neurologists. It's just that headache specialists are going to have more specific training for headache disorders.
That's why they're a specialist.
All right, so a little PSA. I recognize that a lot of these comments, as we said, come from a place of not understanding, from concern, and from care. However, it's important to remember that people with chronic illnesses hear these things a lot, and they're very invalidating.
Yeah.
So I'm not throwing shade at anyone who has said any of these things, because I get that we see someone in pain, we don't like that, and we try to help.
Yeah.
These are just, I'm educating. Mm-hmm. These are some other things not to say to someone with a chronic illness.
Yes.
You're too young to be this sick.
Great.
I get that all the time. You don't look sick. Especially
you.
invisible illnesses are tough.
Yeah.
This is another one. It can't be bad if you can do XYZ. So I'm going to just go off a little bit here. Everyone's different. People don't see the prep work or the toll. We also get really good at disassociating from our bodies.
Yeah.
So it's like, I can't believe that you can do these things with the conditions you have. Okay. Well, you also don't see how much work I have to put into showing up, and then you don't see what happens afterwards.
And you don't, well, I was going to say, you don't see the bad days.
That's it. Yeah. Are you sure it's really that bad?
No. I'm just making it, God.
You need to be more positive. General reminder here, ableism is a real thing. Helpful things to say to someone who is dealing with a chronic illness. It is okay to validate how much it sucks.
Yeah.
And I think people really, really need that. Sometimes I need someone to tell me, you know what? Yeah, that really does suck, and that's okay, and it's allowed to suck.
Yeah. This is bullshit, and you don't deserve it.
No, not even that. Just say, this really sucks. Like, it's okay that it sucks.
Yeah.
And just if someone is in a place where they are not safe or they are thinking about harming themselves because of their chronic condition, call one of the helplines we're going to put in here.
Yes, we will put them in the show notes.
But it's okay to validate that things suck. Things are allowed to suck.
Yeah.
Also, find out what the person needs, not what you think. So that, can I pray for you? You know, I see you're having a pretty bad attack. What do you need? What can I give you? And that goes for so many things. That goes for grief. Mm-hmm. That goes for just people having a hard time. Mm-hmm. I think we try to be helpful. I'm like, well, I would like this, right? In that position, that doesn't mean the other person will like it. And then patience and understanding.
Yeah.
All right, so this was long. What thoughts? What are the thoughts in your head?
Oh, man. I mean, all of this is fascinating.
I talked a lot in this one.
Yeah. And you did a really, really good job.
It's like I live with it.
Yeah. Like I said, I am really interested in like weird medical stuff, and I think that migraines fall firmly in that category. And I think it's a really, really important topic about.
Topic.
Whoa. A really important topic to talk about. There we go. Just because it is oftentimes, even in the year of our Lord 2025 here, it's seen, oh, it's just a headache. It's just a bad headache. And it's not. It's so much more than that. So Thank you for doing this.
Thank you for listening.
Of course. So what drew you to this topic?
So June is Migraine Awareness Month.
Migraine Awareness Month. Let's go, friends.
I also live with them.
Yeah. Fair enough. Straightforward. Any rabbit holes you would want to go down further?
More about Hildegard.
Yeah.
And just maybe more into those ancient medical practices.
Honestly, we joke about them, but they sometimes, like, they're really interesting.
They are.
Sometimes a little scary, but...
And you can see, like, I can understand why they would drill a hole in someone's head. That is something I never thought I'd say.
Mm-hmm. But it's bad enough. Mm-hmm. And if the pain is bad enough, this sounds crazy, but, like, would you even notice if someone...
Maybe not.
Yeah,
exactly. There's suicidal ideation is really, really high with migraines.
Yeah.
And other chronic pain, because it's like... if you're at the point where, like, if the pain doesn't stop, you're going to want to die, you're not going to care if someone drills in your head.
Yeah.
And, I'm sure that's not for everyone, but when your pain is that bad, it's like...
Yeah. Like, you can hit me in the head with a baseball bat, and I'm not even going to notice, because I'm already in so much pain. Mm-hmm. Not me, personally, but...
You're good.
Yeah.
All right, last one.
What was the strangest part about this topic or research for you?
The advice people gave.
Correct.
I feel like I'm talking about myself a lot in this one, sorry.
No.
I experienced it, though. Some of the stuff people have said to me, it's like...
Yeah.
And, like, I try to react gracefully. Mm-hmm. But I'm just like, for real?
Yeah.
Let me just, get an exorcism. You know what? I've tried everything else. Why not?
At this point, why the fuck not?
Put some holy water in my coffee in the morning.
Yeah. Just brew it in your Keurig.
Starts coughing and showing like, oh shit, I'm the demon.
You're like, am I the problem?
Am I the problem? Am I the evil?
Also, friends, that was entirely joking. Brie is not the evil. It's me.
Okay, now saying a serial killer and a demon walk into a podcast studio.
Well, friends, we'd love to hear from you. If you have a suggestion for a strange or mysterious topic, a comment about an episode, or just want to chat, please reach out. Comment directly on episodes on Spotify, leave a review on either Spotify or Apple Podcasts, or find us on Instagram at @something_strangepod. Subscribe to our YouTube channel at @something_strangepod, and comment on episodes there. If none of that works for you, you can also send us a Gmail at somethingstrangepod24@gmail.com, and the 24 is numeric. Well, strangers, it's time for us to part ways.
Until we meet again, stay away from trepanning.
We'll be back again soon with another
Something Strange.
Stay away from trepanning.